To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, it's May, and that means American Stroke Awareness Month. And I'm joined by Kristen Randall, the manager of ThedaCare Stroke Program. Hi, Kristen.
Hi, thanks for having me.
Well, we're happy to have you on because we want to bring awareness to stroke, which afflicts over 800,000 people a year. Maybe we just start in telling our audience, what is a stroke?
Yeah, so simply put, a stroke happens when blood flow to the brain is interrupted. This can happen because of a blood clot or a brain bleed. Brain cells begin to die almost immediately when deprived of blood flow, which is why time is of such the essence to get help.
I'm glad that you mentioned time because the acronym BFAST helps us identify a stroke. Let's go through what BFAST stands for.
Yeah, so B stands for balance, is there sudden loss of balance or coordination. E is for eyes, is there blurred vision, double vision, or loss of vision. F stands for face, is there facial droop or numbness of the face. A stands for arms, is there weakness or numbness to the arms or legs, especially on one side. S is for speech, is their speech slurred, are they unable to speak or having difficulty understanding. And T stands for time, meaning call 911 right away.
If we think a loved one is having a stroke, is there anything beyond calling 911 that we can do?
Yeah, so the EMS personnel will start getting information for our stroke team, looking at past medical history, medications. They call over what's going on with that patient so our team can meet at the door and get ready to treat this patient immediately.
And let's talk about treating the patient. ThedaCare is an accredited primary stroke program. So what makes ThedaCare so unique in being able to handle a stroke victim?
So ThedaCare is prepared to provide quality care for people experiencing stroke. All of our hospitals are stroke accredited, with Neenah being our comprehensive stroke center. Appleton is a primary stroke center, and our critical access hospitals are all acute stroke ready centers, meaning they have protocols in place to treat a patient rapidly and then get them to the appropriate level of care.
Such an important thing to think about, Kristen, is that time, and ThedaCare certainly is equipped for that time. So let's just remind people what the acronym is, just to check if you think you're having that stroke.
Yep, one more time, that acronym is BFAST, and remember to call 911 if you think you're having stroke symptoms or you're with somebody who's having stroke symptoms.
All right, well, Kristen, thank you so much for joining us here in Stroke Awareness Month. We thank you, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.